Now we'll be looking at two terminologies, and these are some terminologies that you hear them talking about a lot in orthopedics. So when they say bone involvement, what does it mean? When they say joint involvement, what do they also mean by that? So let's look at it. So they are often used in medical contexts, okay, especially when you're talking about the musculoskeletal system. That's the bones, the muscles, the joints, the ligaments, the tendons. So bone involvement just simply means what? A disease process. It directly affects the bone tissue itself. Okay, so let's quickly just look at the definition of joint involvement. It's just a disease process. So this one primarily affects the structures of a joint. Cartilage, synovium, ligament, joint capsule. Do you understand? Why this one is the bone itself. So for example, you can have the osteomyelitis, which is an infection of the bone. You can have tumors like all these primary bone cancers like Osteosarcoma or metastases. You can have metabolic disorders like osteoporosis, rickets, Paget's disease. Alright, so most of the times there's a lot of pain. The bone is weak and could fracture. There's deformities and there's changes in the bone density, and also the structure of the bone that can be seen on imaging is also being changed. Then joint involvement, alright, we have defined it. It affects the structures of the joint. Okay, so things like rheumatoid arthritis, gout, pseudogout, degenerative disease like what osteoarthritis, infections like septic arthritis, swelling. So manifestation causes swellings in the joint. The joint is stiff, and of course the way you used to use that joint before, it is reduced. Okay, so there's reduced range of motion, there's tenderness, there's warmth, and it could also result into a deformity. Okay, so that's what we have for those two terminologies as used in medical context.